Hello, my name is Dr. David Bullock. I'm a physician at Rockcastle Family Wellness, work at Rockcastle Regional Hospital. I work at the ER at Rockcastle Regional, and I'm also the medical director for Quick Care that's associated with Rockcastle Regional. If someone's concerned about coming to the office or coming to the emergency room for current health issues they have, whether that be chest pain or their blood pressure is really high, you're going to get care in the safest situation possible. So every patient comes in one at a time. Patients wear a mask. Everyone in the facility is wearing a mask at all times. Everyone's washing their hands regularly, using hand sanitizer. So truly, the situation in the hospital and in the offices is as safe as it can be, and certainly staying at home with a serious health condition is more risk than it would be coming in and receiving care. Before every patient and after every patient, nurses are using either hand sanitizer or washing their hands, as well as the physicians are. Every piece of equipment has been cleaned with disinfecting wipes or disinfecting solution. So that includes the beds in the rooms, the sinks, any sort of blood pressure cuffs. Any instrument that touches the patient has been thoroughly cleaned in between every patient every time. If a patient feels like they've been exposed to COVID or that they may have symptoms, so they have shortness of breath, fevers, headaches, any of the other symptoms that we have heard about so much, they should call ahead. So the best thing to do is either call the office or call the emergency room, depending on where you're going to find care. That way preparations can be made. We can have the appropriate personal protective equipment on. We can keep you isolated, and we can get the test done in a safe manner. And that way it protects both all the other patients as well as the people who work at this facility. At Rockcastle Family Wellness, when a patient is coming in to be seen, the patient will come to the parking lot, they'll call in, and they will register over the phone, so not having to get out of their car. All patients who enter any part of Rockcastle Regional, whether it be the Rockcastle Family Wellness, ER, Quick Care, or in the limited visitation hours, are met by a screener at the front door. In those situations, the screener will ask several questions, screening for symptoms of COVID, take temperatures, provide masks if you need those, and then give further instructions based off that. That does mean if you show up to our facility and you have a fever, you are going to be either referred to an isolated area if you are a patient and need to be treated, or if you were there just to visit, then you will not be allowed to visit that day with a fever. This is the best protocol that we can have in place to try to keep down the spread of corona and keep everyone safe. The room that's available will have already been disinfected and sanitized before the patient ever comes into the facility. Besides the equipment being sanitized and a very good use of hand sanitizer and hand cleaning, it will be a very similar visit, except that we do request that both the provider and the patient wear a mask. We feel like that this process has worked quite well. We've been doing it now for several months without many issues. I think that it keeps patients safe and it allows us to provide care in a manner which does not put patients at risk. Rockcastle Family Wellness has done telehealth since this pandemic started. We have had many more visits than usual associated with that. Due to the pandemic, they have decreased some of the regulations associated with that, which has allowed many more people to have access to that. So if you're very uncomfortable coming to the office, we do offer telehealth services via Facebook, via FaceTime, as well as a couple other mediums. Most other things we can handle through telehealth. So we still have a significant population that are doing telehealth instead of coming to the office, and that works well, and that can be set up through the office just like a normal visit. You're going to get care in the safest situation possible.